So what's happened is that with our world that we're living in, we're starting to see more and more people with hormone-related problems that we never really saw before. We're exposed to all sorts of pollutants, different chemicals in our lives, and what's happening is it's causing us to prematurely age. We're starting to see more cancers, more heart attacks, more strokes, more premature death. We haven't done ourselves a favor with what we've done with America as far as our food supply, our water supply, everything. And so hormone deficiency is more and more of a problem now than it ever has been. Plus, it's starting to get recognized as something legitimate. So some of the signs that some of the symptoms that you might have if your hormones are starting to get depleted, maybe a little bit of brain fog, maybe it's harder to concentrate on a task, maybe I'm a little bit more distracted by some of the squirrels that are in my room, maybe I just don't feel motivated, I don't have as much energy as I used to have. You go to see your doctor says, they do labs on you, they say, well, you're fine, you're just getting old. Well, you don't have to accept that. We will get old at a chronological age, but that doesn't mean we need to feel it. Other things that you can notice if your hormone levels are out of whack is that all of a sudden maybe you're starting to put on a few extra pounds, maybe a couple pounds this year, maybe a couple pounds the year before. Next thing you know, you've got an extra 20, 30 pounds on you, which makes you have more joint pains. I really don't feel like getting up and moving because I just as soon sit here and watch the world go by. Sleep starts becoming an issue for both men and for women. Women are really obvious because we have this magical thing called menopause. There's a before and there's an after. So it's like all of a sudden the light switch turns off and you just don't feel the same way that you used to feel. When a man goes through what we call andropause, there's no sudden thing that happens. It's just kind of progressively decreasing levels of testosterone throughout your life. And at what point does that straw break the camel's back that all of a sudden you feel like, man, I just can't make it through my day anymore? What your options are, you can get put on prescription drugs to maybe take care of your blood pressure, maybe take care of your cholesterol, your diabetes, or you can try to treat things naturally. And what we try to do here at Ignite is we try and get to the root cause of what's causing your issues. Sure, I can put Band-Aids on all the different things that you're having. I can put you on a blood pressure medicine or cholesterol medicine or diabetic medicine, but that's not fixing what's causing these diseases. If we can get back to having a healthy life, eating well, sleeping, I want people to be able to go to the bathroom. I want people to have energy throughout the day. And if we can dial in some of these natural things so that you don't have to have blood pressure issues, you don't have to have cholesterol issues, you don't have to have diabetic issues, we can oftentimes get people off of those meds for those particular things. How you would know to come in to see me, maybe you've just kind of noticed that you aren't as perky as you used to be, maybe not as motivated. So you go see your family doctor, they run a lab panel, and it's all normal. There's nothing wrong with you, you're just getting old. Well, you don't have to accept that. When we take a look at labs here, we don't just take a look at normal values, we take a look at what are optimal values. There's no reason, for instance, a 400-pound man that sits on a couch and smokes 2 packs a day should have the numbers as a healthy 20-year-old person. And we shouldn't have those same kind of numbers. So we look at optimal levels, and I want to try and optimize your life so that you feel as good as possible. Oftentimes that can be related to low testosterone or an imbalance between your testosterone and estrogen levels. So we take a look at that very seriously, and we can try and optimize things to improve your sex life, but not just that, your brain function. We want to try and improve your heart function, your vascular function as far as the circulation throughout your body. We want to try and make you as young and healthy and viable as you can possibly be. My goal is to have you looking and feeling great until the day that you keel over and die. I don't want to see a progressive decline. I'm getting worse and worse. I'm getting into assisted living. I'm getting to a nursing home, and then I'm going to die. I want to go out swinging. So one of the reasons that I like the BioT method of hormone optimization is everything is done naturally and it's done individually. Everything that we do here to manage hormones is natural, bioidentical. And what that means is atom for atom, the hormones that we're talking about are exactly the same as what your body used to make. With the BioT method, what we do in our office is somebody will come in because they've got some symptoms, maybe fatigue, maybe weight gain, maybe some brain fog, insomnia, irritability, something like that. They come in to see us. We have about an hour introductory visit where we find out what's going on as far as that person's life, their past history, what kind of medications they're on, what types of things have they tried in the past, and then we give a little presentation about what hormones can do for you. After that first visit, we like to check a lab panel. We have kind of a detailed panel that we go through, looking at not just the hormones, but also taking a look at your blood sugar, your kidney function, your electrolytes, your liver functions, your blood counts, some of the basic things that may not have been optimized by previous visits with your family doctor. After those labs come back, we usually sit down, go over everything in detail. It takes about an hour or so to do that, and at that time we can discuss whether or not you'd be a candidate for receiving BioT pellets. So what BioT pellets are, they're natural, bioidentical hormone pellets of either testosterone or estrogen, or a combination of the two if you're a woman. We figure out whether or not you're a candidate based on several things. Every single patient that comes in to see us fills out a checklist, symptoms that are going on, and they rate those from everything from never to mild to moderate to severe. We can take a look at that checklist and say, wow, everything is out of whack here. Let's do some things to try and figure out why you're out of whack. And the lab panel helps to allow us to do that, as well as doing some questioning and answering as well. When we do the follow-up with the labs, we go over things in great detail, and we come up with a dosage that would be unique for you, that's be different from John Doe who's down the road from you. And we come up with something that's individualized for your particular situation. It's not a one-size-fits-all type thing. You know, a man that weighs 150 pounds is obviously not going to get the same doses of a medication as a man that weighs 300 pounds. Or let's say you have two 300-pound men. One man is very muscular and very active, and the other one is more of a couch potato and very floppy. So they're not going to get the same amount of hormones. With the BioT method, these pellets are released into your system based on your cardiac output and metabolism. So everybody's different. So we try to individualize that to what your particular circumstance is. So the pellets get implanted through a small incision that's typically done either in the upper butt cheek or in the love handle area. We deaden the skin with lidocaine so you don't feel it, and then we make a very small incision, 3 millimeters for a woman, 4.5 millimeters for a man. In that incision, we put a little tube called a trocar, which allows us to introduce these subcutaneous hormone pellets. These pellets are about the size of a mechanical pencil eraser. I think that's about the best way to describe them. They come in different strengths, they're not all the same strength, and then these pellets get inserted through that small little trocar into the fat underneath your skin. The reason we use fat has a good blood supply. So as those pellets are sitting there, within 24 to 48 hours, little blood vessels will start growing around them. And as those pellets start dissolving, we get 100% uptake into our bloodstream, which, by the way, is not something that happens with other methods of hormone administration. Other methods of hormone administration might be topical via creams or gels or patches, or it might be intramuscular via including synthetic testosterone shots. We try to do things naturally with the pellets. The advantage of the pellets is we have sustained consistent levels for several months. For men, usually about 4 to 5 months. For women, about 3 to 4 months. And as these pellets start wearing off, oftentimes people will start finding some return of their original symptoms, maybe a little bit more return of that fatigue, that insomnia, that irritability. When some of your symptoms start returning, that's when it's time to do a repeat pellet. Like I said, for women, it's usually about every 3-4 months. For men, it's about every 4 to 5 months. And it'd be time to repeat the process at that time. So one of the reasons why I got involved in hormone replacement is my prior career as an emergency room physician. I practiced emergency medicine for 35 years, where, yeah, we might save somebody's life, bring their heart back, but we don't really fix people. Here's an issue, here's a medicine for that. Side effect from that medicine, here's another medicine. So we're just going to keep putting on more and more medications. Meanwhile, we're not fixing what's going on with you. So after 35 years of trial and error and realizing, man, maybe it's kind of messing people up by putting them on all these drugs, what we're doing now is doing exactly the opposite. We're trying to get people off of drugs, off of medications to live life naturally. And people might ask me, it's like, well, do you feel like you wasted those 35 years? It's like, no, I think those 35 years is what made me the person I am now. And now I feel like I've got that experience to say, wow, this is what happened with that disease if we go untreated, or if we put you on some type of artificial medication, or we can do things naturally and prevent that from happening in the first place. I think one thing that sets Ignite RX apart from other places is the amount of time that we spend with each patient. Each visit to see me is an hour initially, and then the follow-up is another hour. And then when you come in for follow-up of labs after that, it's anywhere from 30 to 60 minutes. So it's not a quick 5-6 minute visit like you might have at other physicians' offices. We actually take the time to care, and I think that we make a difference. And our patients are happy, and they like us.